I've been involved with behavioral health for about 16 years. I started volunteering at an inpatient facility where I had actually been hospitalized. I live well with bipolar disorder, and so a lot of my work is focused on the whole use of peer support services in varying settings, whether it's in the community, at the grassroots level, all the way up through the whole continuum of traditional provider services, inpatient settings, as well as linking people back to grassroots peer supports in the community. So one of the unique things about peer support is that it exists along the whole continuum of care, including outside the healthcare system. So I think it brings a unique set of skills that people have. People are passionate about this. People do peer support because they know it works and they've seen the power of it in their own lives. Magellan is different in this area because of our appreciation for the value of lived experience. Between our peer roles within public sector and Magellan Complete Care, we have over 200 years of experience of people who've been doing this work in their communities at the state, local, and national levels. We bring this work to Magellan. It's embraced by the rest of the leadership teams, by the direct care teams at all levels, and it's really part of Magellan's culture. So I think that we really walk the walk and not just talk the talk when it comes to recovery, wellness, and supporting people move forward with their lives in a way that's self-determined. Someone said that health is a state of body, whereas wellness is a state of being. And I think that really kind of resonates with what our approach is in looking at a whole person's life. I think everybody has different definitions of what helps keep them well. And a lot of it is really not related to healthcare systems, about peer support, about social connections, about meaningful day out, what you do during the day as far as your job or volunteering. Peer groups are identified a different way by different people. It's not all in the context of a psychiatric disability. So the whole concept of wellness is emerging as a much broader, more holistic way that really is a whole person approach. Magellan frames our work in this area around the 8 dimensions of wellness that SAMHSA has endorsed, that Dr. Peggy Swarbrick did a lot of work around. And in all those 8 dimensions, our goal is to try to help understand what it is that we can do to support people being linked to these resources in the community that help encourage and improve their own personal wellness across these 8 dimensions. Whether it's creativity, certainly physical and emotional health is a big part of this, but also financial, safe housing. All of these things really contribute to wellness on an overall basis, or something that we look beyond just the touch points of healthcare, even though we are a really effective healthcare delivery system.